34. The cranial bones that forms the most posterior portion of the skull are the dash bones. A. Ethmoid. B. Occipital. C. Parietal. D. Sphenoid. Answer: B. Occipital. Rationale: the occipital bone forms the posterior part of the skull and houses the foramen magnum through which the spinal cord passes. 35. The cranial bones shaped like a butterfly that forms the sides and floor of the cranium are the dash bones. A. Ethmoid. B. Occipital. C. Sphenoid. D. Temporal. Answer: C. Sphenoid. Rationale: the sphenoid bone is often described as resembling a butterfly and forms a central part of the skull's base, contributing to the orbits and the floor of the cranium. 36. The hard palate is formed by the dash and dash bones. A. Mandible, maxillae. B. Maxillae, palatine. C. Palatine and zygomatic. D. Zygomatic and vomer. Answer: B. Maxillae, palatine. Rationale: the hard palate, which forms the roof of the mouth, is made up of the maxillae and palatine bones. 37. The bones that serve as pathways for ducts that carry tears from the eyes to the nose is the dash bone. A. Ethmoid. B. Lacrimal. C. Maxillae. D. Nasal. Answer: B. Lacrimal. Rationale: the lacrimal bones contain the lacrimal fossa, which houses the lacrimal sac, serving as the drainage pathway for tears from the eyes to the nasal cavity. 38. The cheekbones are predominantly formed by the dash bones. A. Maxillae. B. Parietal. C. Temporal. D. Zygomatic. Answer: D. Zygomatic. Rationale: the zygomatic bones, also known as cheekbones, form the prominence of the cheeks and contribute to the orbits. 39. The upper jaw is formed by the A. Mandible. B. Maxillae. C. Vomer bone. D. Zygomatic bones. Answer: B. Maxillae. Rationale: the maxillae are the paired bones that form the upper jaw and contribute to the orbits and nasal cavity. 40. The lower jaw is formed by the A. Mandible. B. Maxillae. C. Vomer bone. D. Zygomatic bones. Answer: A. Mandible. Rationale: the mandible is the only movable bone of the skull and forms the lower jaw. 41. The nasal septum is formed by the dash bone and the perpendicular plate of the dash. A. Nasal, ethmoid. B. Ethmoid, nasal. C. Ethmoid, vomer. D. Vomer, ethmoid. Correct answer: C. Ethmoid, vomer. Rationale: the nasal septum is comprised of the perpendicular plate of the ethmoid bone and the vomer bone. 42. The only movable bone of the skull is the A. Cranium. B. Mandible. C. Maxilla. D. Vomer. Correct answer: B. Mandible. Rationale: the mandible, lower jaw, is the only movable bone in the skull. All other bones are fused. 43. What is the name of the ushaped bone located superior to the larynx? A. Hyoid. B. Thyroid. C. Zygomatic arch. D. Clavicle. Correct answer: A. Hyoid. Rationale: the hyoid bone is ushaped and located above the larynx. It supports the tongue and is not directly attached to other bones. 44. What is the only bone in the body that does not articulate with another bone? A. Patella. B. Hyoid. C. Distal, phalanges. D. Occipital. Correct answer: B. Hyoid. Rationale: the hyoid bone does not articulate with any other bone. It is suspended by muscles and ligaments. 45. Within the vertebral column there are dash cervical vertebrae, dash thoracic vertebrae and dash lumbar vertebrae. A. 5:10:5. B. 5:12:5. C. 7:12:5. D. 7h12:07. Correct answer: C. 7:12:5. Rationale: the vertebral column consists of 7 cervical, 12 thoracic, and 5 lumbar vertebrae. 46. The adult sacrum consists of dash vertebrae fused together. A. 5. B. 7. C. 12. D. 31. Correct answer, A. 5. Rationale: the adult sacrum is formed from the fusion of 5 sacral vertebrae. 47. The atlas is also known as the dash vertebrae. A. C1. B. C2. C. C7. D. D1. Correct answer, A. C1. Rationale: the atlas is the first cervical vertebra, C1, and supports the skull. 48. An abnormal lateral curvature of the spine is A. Kyphosis. B. Scoliosis. C. Lordosis. D. Hunchback. Correct answer, B. Scoliosis. Rationale: scoliosis is characterized by an abnormal lateral curvature of the spine. 49. What ribs are attached to the vertebrae? A. Cervical. B. Lumbar. C. Sacral. D. Thoracic. Correct answer, D. Thoracic. Rationale: the ribs articulate with the thoracic vertebrae. 50. There are dash vertebrosternal ribs, dash vertebrochondral ribs, and dash vertebral ribs. A. 552. B. 633. C. 732. D. 822. Correct answer, C. 732. Rationale: there are 7 vertebrosternal ribs, true ribs, 3 vertebrochondral ribs, false ribs, and 2 vertebral ribs, floating ribs. 51. The ribs that attach to the thoracic vertebrae and directly to the sternum via costal cartilage are called dash ribs. A. Vertebral. B. Vertebrochondral. C. Vertebrosternal. Correct answer, C. Vertebrosternal. Rationale: vertebrosternal ribs, true ribs, connect directly to the sternum through costal cartilage. 54. Identify the bones that form the pectoral girdle. A. Scapulae and clavicles. B. Radii and ulni. C. Coxal bones. D. Tibiae and fibulae. Correct answer, A. Scapulae and clavicles. Rationale: the pectoral girdle is made up of the scapulae and clavicles. 55. In anatomical position, identify the forearm bone that is most lateral. A. Radius. B. Ulna. C. Tibia. D. Fibula. Correct answer, A. Radius. Rationale: in the anatomical position, the radius is located on the lateral side of the forearm. 56. The arm bone is also known as the A. Carpals. B. Humerus. C. Radius. D. Ulna. Correct answer, B. Humerus. Rationale: the humerus is the long bone of the upper arm. 57. The wrist bones are the A. Carpals. B. Metacarpals. C. Metatarsals. D. Tarsals. Correct answer, A. Carpals. Rationale: the carpals are the 8 bones that make up the wrist. 58. The head of the humerus articulates with the glenoid cavity of the A. Femur. B. Radius. C. Uscocha. D. Scapula. Correct answer, D. Scapula. Rationale: the head of the humerus fits into the glenoid cavity of the scapula, forming the shoulder joint. 59. The depression on the posterior side of the humerus for the ulna when the elbow is extended is the A. Capitulum. B. Head. C. Olecranon fossa. D. Trochlea. Correct answer, C. Olecranon fossa. Rationale: the olecranon fossa allows the olecranon of the ulna to fit into it when the elbow is extended. 60. In one hand, there are underscore carpals, underscore phalanges. A. 555. B. 759. C. 8514. D. 8515. Correct answer, C. 8514. Rationale: there are 8 carpals, 5 metacarpals, and 14 phalanges in one hand. 61. Identify the three regions of the coxal bones. A. Acetabulum, ilum, and pubis. B. Acetabulum, ischium, and pubis. C. Ilium, ischium, and sacrum. D. Ilium, ischium, and pubis. Correct answer: D. Ilium, ischium, and pubis. Rationale: the coxal bone is composed of the ilium, ischium, and pubis. 62. The most inferior portion of the coxal bone is the A. Acetabulum, B. Ilium, C. Ischium, D. Pubis. Correct answer: C. Ischium. Rationale: the ischium is the most inferior part of the coxal bone. 63. The most anterior portion of the coxal bone is the A. Acetabulum, B. Ilium, C. Ischium, D. Pubis. Correct answer: D. Pubis. Rationale: the pubis is the most anterior part of the coxal bone. 64. The depression of the coxal bones where the head of the femur articulates with the coxal bone is called the A. Acetabulum, B. Obturator foramen, C. Sciatic notch, D. Pubic symphysis. Correct answer: A. Acetabulum. Rationale: the acetabulum is the socket in the coxal bone that receives the head of the femur. 65. The thigh bone is the A. Femur, B. Humerus, C. Tibia, D. Ulna. Correct answer: A. Femur. Rationale: the femur is the bone of the thigh and is the longest bone in the body. 66. Identify the bones of the leg. A. Only the femur, B. Only the tibia and fibula, C. Femur, fibula, tibia, and patella, D. Femur, fibula, tibia, patella, and tarsals. Correct answer: C. Femur, fibula, tibia, and patella. Rationale: the leg consists of the femur, tibia, fibula, and patella. 67. Explain why female hips are broader than male hips. A. Female iliac bones are more flared. B. Female ischial bones are more flared. C. Female pubic bones are more flared. D. Female bones are thicker. Correct answer: A. Female iliac bones are more flared. Rationale: female pelvises are wider due to more flared iliac bones to accommodate childbirth. 68. The pelvis is formed from the A. Just the coxal bones, B. Coxal bones, sacrum, and coccyx, C. Coxal bones and scapulae, D. Clavicles, scapulae, and sternum. Correct answer: B. Coxal bones, sacrum, and coccyx. Rationale: the pelvis is composed of the coxal bones, sacrum, and coccyx. 69. Which of the following is not a part of the coxal bone? A. Sacrum, B. Ilium, C. Ischium, D. Pubis. Correct answer: A. Sacrum. Rationale: the sacrum is not part of the coxal bone, it is a separate structure. 70. In one foot, there are dash tarsals, dash metatarsals, and dash phalanges. A. 555. B. 7,514. C. 8,514. D. 8,515. Correct answer: B. 7514. Rationale: there are 7 tarsals, 5 metatarsals, and 14 phalanges in one foot. 71. The heel bone is the A. Calcaneus, B. Fibula, C. Patella, D. Talus. Correct answer: A. Calcaneus. Rationale: the calcaneus is the heel bone, the largest of the tarsal bones. 72. An immovable joint is called a/an. A. Diarthrosis, B. Amphiarthrosis, C. Osteoarthrosis, D. Synarthrosis. Correct answer: D. Synarthrosis. Rationale: synarthrosis refers to joints that are immovable. 73. A suture is an example of a dash joint. A. Synovial, B. Fibrous, C. cartilaginous. Correct answer, B. Fibrous. Rationale: sutures are fibrous joints found in the skull, allowing minimal movement. 74. The suture between the parietal and occipital bones is the dash suture. A. Coronal. B. Lambdoidal. C. Sagittal. D. Squamosal. Correct answer, B. Lambdoidal. Rationale: the lambdoidal suture connects the parietal bones to the occipital bone. 75. Which of the following is not a cartilaginous joint? A. Between the bodies of vertebrae. B. Between a tooth root and its socket. C. Between a rib and the sternum. D. Between the pubic bones. Correct answer, B. Between a tooth root and its socket. Rationale: the joint between a tooth root and its socket is a fibrous joint, not cartilaginous. 76. The freely movable joint is called A. Cartilaginous. B. Synovial. C. Diarthrotic. D. Both B and C are correct. Correct answer, D. Both B and C are correct. Rationale: freely movable joints are classified as synovial and diarthrotic. 77. The joint between the carpal and first metacarpal of the thumb is a dash joint. A. Hinge. B. Condyloid. C. Saddle. D. Gliding. Correct answer, C. Saddle. Rationale: the carpometacarpal joint of the thumb is a saddle joint, allowing for a wide range of motion. 78. The hip and shoulder are dash joints. A. Saddle. B. Ball and socket. C. Hinge. D. Condyloid. Correct answer, B. Ball and socket. Rationale: both the hip and shoulder joints are ball and socket joints, allowing multidirectional movement. 79. The knee and elbow are dash joints. A. Hinge. B. Ball and socket. C. Saddle. D. Gliding. Correct answer, A. Hinge. Rationale: the knee and elbow joints function as hinge joints, allowing movement in one plane. 80. Which joint allows for up and down movement in one plane? A. Gliding. B. Hinge. C. Condyloid. D. Saddle. Correct answer, B. Hinge. Rationale: hinge joints allow for movement primarily in one plane, similar to a door hinge. 81. What joint between the atlas and axis? A. Gliding. B. Pivot. C. Condyloid. D. Hinge. Correct answer, B. Pivot. Rationale: the atlantoaxial joint allows for rotational movement and is classified as a pivot joint. 82. To bow before a king is an example of A. Extension. B. Abduction. C. Adduction. D. Flexion. Correct answer, D. Flexion. Rationale: bowing involves flexion at the hips and possibly the knees. 83. To flap your arms like a bird involves A. Flexion and extension. B. Supination and pronation. C. Abduction and adduction. D. Elevation and depression. Correct answer, C. Abduction and adduction. Rationale: flapping arms involves moving them away from the body, abduction, and then back towards the body, adduction. 84. Doing arm circles is an example of A. Rotation. B. Circumduction. C. Flexion. D. Pronation. Correct answer, B. Circumduction. Rationale: arm circles involve moving the arm in a circular motion, which is called circumduction. 85. The movement used to cup your hands to get a drink is A. Pronation. B. Depression. C. Eversion. D. Supination. Correct answer, D. Supination. Rationale: supination refers to the rotational motion of the forearm that turns the palm upward. 86. Which of the following is an autoimmune disorder that results in damage to joints? A. Rheumatoid arthritis. B. Osteoarthritis. C. Osteoporosis. D. Bursitis. Correct answer, A. Rheumatoid arthritis. Rationale: rheumatoid arthritis is an autoimmune condition that causes chronic inflammation and damage to the joints. 87. The deterioration of articular cartilage is called A. Osteoporosis. B. Rheumatoid arthritis. C. Osteoarthritis. D. Gouty arthritis. Correct answer: C. Osteoarthritis. Rationale: osteoarthritis involves the wear and tear of articular cartilage over time, leading to pain and stiffness. 88. What mineral is stored in bone? A. Vitamin C. B. Calcium. C. Oxygen. D. Potassium. Correct answer: B. Calcium. Rationale: bones serve as a reservoir for calcium, which is essential for many bodily functions.
Thank you for taking the quiz. How many did you get? Let me know in the comment section.